Hello, it's great to be here today, and I want to thank YOSSI and Alan for inviting me to talk about what's the future of healthcare. I think everybody in this room is in a unique position to be interested in that, because sooner or later, we might not grow a garden, we might not worry about where our food comes from, but I'll tell you, sooner or later, we'll all worry about our own health care and the health care of our loved ones. So I think this is a very, very personal story and a personal discussion. So in a few minutes, I want to discuss my own vision for where healthcare is going and where we as Siemens Healthcare think healthcare is going. Today, you'll hear a lot about paradigm shifts, and I have a few up here. You'll hear about genomics, you'll hear about big data AI, you'll hear about tracking and personal tracking, and I think they're all important. But I have to ask you a question, are they enough, and are they really solving the future challenges of healthcare? Because when you think about healthcare, since we're in Jerusalem, since the days of pre-Bible, there's been a very limiting factor in healthcare. And when I look at what I think are the 5 likely truths, the one that I label as 0 here, the one that I label as kind of the foundational issue that we have to tackle for the future of healthcare is the internal productivity challenge of healthcare. So since biblical times, it was who can taste urine the best and determine if you're diabetic, to today, where your medical outcomes are largely based on your treating physician, are largely based on the experience and knowledge of your treating physician. And you just heard from Zebra, they're trying to attack one piece of the puzzle on how to fix that. And really, I implore everybody in this room to think through, as the future of healthcare, how do we really form an ecosystem? How do we really take global knowledge and apply it locally? Because until we solve the problem where you're no longer maybe the 100th patient that the treating physician has seen with this condition or the 1,000th patient, we can take global knowledge where you could be the 300 millionth patient with that condition, and we look at what have those previous 300 million been treated with, what have been the best practices, and how in real time do we adapt your treatment to your own unique biology. That will be the future of healthcare. And using that, medicine will become more precise and accessible. You'll leverage that global knowledge. You'll no longer need that direct treating physician to guide you. So whether it comes to treating what kind of food you should eat or what kind of surgery you would need, whether it becomes everybody's a doctor and being empowered in the knowledge of how to be a doctor because knowledge is so accessible, to shifting from who controls the patient, who's in front of you, to the data and insights that we get from this global knowledge. And in the end, the way we make money today in healthcare, because it is a business, will greatly shift, because the strategic control points will come from the direct interaction of the patient to leveraging this global knowledge to global challenges to the individual patient. And thank you, and looking forward to talking to people later today.
I'm happy to invite Marco Huesch from Ping An to join.
Thank you, Lali. I'd like to thank John Medved, YOSSI BAHAGON, Alan KAMER for the invitation to speak with you today for a few brief minutes on how Ping An, a Chinese insurer, the most valuable insurance company in the world by market capitalization, thinks of healthcare, thinks of innovation, and thinks of Israel. So let me just give you a 10-second introduction to us. We're 30 years old, and in that time, we're the only joint stock company with the most financial services licenses. We have almost $1 trillion of assets, and we span literally hundreds of millions of customers in China. This amazing customer-facing focus has allowed us to think over the last 30 years of how we look after customer needs best. We have a Ping An technology group which has 22,000 developers, world leaders in facial recognition, in voice printing customers. We wouldn't be able to handle more than 1 billion inbound calls a year with humans. A lot of what we've done in our traditional businesses we see as a template for moving forward, and it resonates when we hear the innovators in the room. So we think going forward that we'll be a data-driven technology business as opposed to a traditional insurance business. And I think the most important slide I can show with you is our feeling, our belief about healthcare's paradigm shifts. We think that the iron triangle is starting to be burst and broken. I practiced medicine 30 years ago, and there's many physicians in the room, folks like YOSSI, BAHAGON, who lived within a paradigm of you could pick two at best of these three dimensions, either affordability or great customer service or high quality. Maybe you could only pick one, and in some awful places you could pick none of these. We're starting to feel that the time is to break this iron triangle and simultaneously achieve success in all of those three dimensions. And I think 5 vectors of the data-driven economy make this really possible. And we appeal to essentially non-healthcare institutions that have shown us the way in terms of the addressability of adjacent verticals or entirely new industries, in terms of turning data into value, in terms of refining user experiences that speak to empowered consumers that increasingly know as much as Dr. Google does. The examples of straight-through processing and non-human factors that we see with Tesla, for example, this radical automation and the access of capabilities in-house to partners in an open ecosystem are things, vectors that we believe will help drive success in that iron triangle. And there's obvious examples we could spend a lot of time talking about in healthcare that we start to see. Let me kind of wrap this up by saying earlier this week, we announced that we led TytoCare's $25 million financing round. TytoCare obviously part of OurCrowd, Qure's strategic healthcare in-house fund. And we are excited to be part of TytoCare's future, which does so many of these things on the right-hand side. And together, we believe that universal access to care that is affordable and standard quality and safety will be enabled by folks like TytoCare, OurCrowd and Qure, and the innovators in the room. Thank you very much.
I'm happy to invite Valerio Nannini from Nestle to share as well the collaboration with Qure.
Good morning to everybody, and it's a pleasure to be here. Nestle, the interaction between nutrition, health, and wellness has been at the forefront of the strategy of Nestle over the last 15 years. And no other better time can illustrate how important is this connection happening. And you have here 3 S-curves, and you see where we are today. We're at the end of the first S-curve, and what you have on the other 2 S-curves is what's going to happen. And it's happening, because today, to be able to understand our DNA and the relationship between DNA and food and our well-being is happening. Microbiome is starting understanding this element. And even yesterday, we saw the connection between robotics, artificial intelligence, computing power, and the big data. And being able to mine that big data is becoming more and more possible. And to be able to understand what each one of us needs to have a better life and fulfill our elements, it becomes very important. For us, improving nutrition and connecting with health becomes a very, very strategic piece of work we need to do. When you ask to people like you, like us, what they want to have, they're very, very clear in what they want from a platform that is coming out of the digital nutrition and health sector. And you can read it yourself. Simple, easy to use, personalized. All those elements become very, very important when you talk to people. This has done a major piece of research done with different partners and done in the States between age groups between 35 and 60. So you can clearly see there's a unifying theme, simple and easy. So when you look at digital nutrition and health, what are they connecting and what are the elements and what the platform needs to do, if you take out all that piece of research and you distill it into 3 pieces, is people want to have ways of capturing nutrition in a very easy and simple manner. Tagging or replying to a lot of questions, that's not the way. Voice is a natural way, pictures a natural way. More and more technology will come in our way to be able to do that. Think about 5G and the 3D cameras. That will open a total new dimension in being able to capture information about what we eat. The second point, it needs to be personalized. And the third point, it needs to understand and it needs to be enjoyable. And these are the major problems we have. We all enroll in these type of programs, and after 1 week or 2 weeks, we stop doing it. So to do this, and this is going to be really important, is my final slide, we need an ecosystem of players that come together. It's not a nutrition company alone. It's not a technology company alone. It's not an insurance company, as we saw with Penang or Siemens. It's everybody that comes together. And so there's no better place than here at the OurCrowd Summit to say this is the right place to start thinking about an initiative that can have enablers and solutions around what I would call a big theme, a big problem. How can we live better? How we can eat better in order we have a more fulfilling and a better life? Because we know that the impact of lifestyle depends very much on what we eat. At the end, the food can be your medicine. As not me said it, but somebody more famous than me many, many years ago, probably more than half of the life of this town. So thank you very much. It's just a teaser for you to think, what are you going to do to improve your nutrition and at the same time, through all the sensing technology you have, not only on the car, but probably in the future in your body, to have a better life and to be more around in the future. Thank you very much.
Putting all of this together, I'm happy to invite to the stage the co-founders of Qure, Dr. YOSSI BAHAGON and KAMER, who brings all of these different industry leaders together and together explore digital health. YOSSI, Ellen.
So thank you, Lally. I'm YOSSI. This is Alan. We are the managing partners of Qure. You just heard from the top executives of the world's leading organizations that are part of the Qure ecosystem. These strategic partners provide us priceless value as they bring us feedback during the diligence process. They give us insights into their unmet needs and into their priorities. And of course, they are also potential investors and acquirers of our companies. Most importantly, these partnerships has become strong friendships between the people that create this unique vision and opportunity.
Our companies benefit by these relationships in many ways. First, there's fast-track access to decision makers and their teams to have true feedback on what's going on and what opportunities exist. Product input, including very valuable insights into future designs. And of course, the opportunity to scale their solutions and commercialize globally with some of these corporate partners. Come join us after the break for a special digital health panel. We'll hear more from our partners about what it takes to work with them and some of the insights they can provide for portfolio companies. Thank you very much.